welcome to Parkbench, Fort Myers. I'm Pamela Pipher with VIP Realty Commercial. This afternoon, we're talking with Katie Worsnick. She's a PA at Caring Medical Regenerative Medicine. Hi, Katie. How are you today?
I'm great. How are you?
Fine, thank you.
Good.
So we're really excited about learning about Caring Medical. I am a patient here, and I'm really excited to share with the world and Fort Myers what it is that you do here. Can you please tell us what is unique about Caring Medical, what it does for patients, and pain and injuries?
So here at Caring Medical, we see a lot of chronic pain patients who have kind of been through a lot of other treatments, or, chronic pain patients who are just looking for alternative treatments. And basically we do something called prolotherapy, which is a form of injection therapy, regenerative medicine, that stimulates the body to heal itself.
Okay, so tell us about the injections and the therapy itself. Is it one session? Is it many sessions? How many injections? What are the injections?
So we use basically a dextrose solution to the injured area. So if it was the shoulder, for example, we would do all the ligament and tendon attachments to make the joint more stable. When the ligaments are kind of loose or lax, the joint can become unstable and make that area more prone to injury. So basically we're taking an unstable joint and making it a stable joint.
And that causes inflammation?
Yes, so it's a local inflammatory response for your body to send good cells to the area to kind of take away bad stuff and lay down new tissue.
Okay, fantastic. And I know because I've been experiencing that with my shoulder, so feel free to use my shoulder as an example. Okay. So what is the patient experience like?
So most patients tolerate the procedure very well. We see a lot of patients of all ages from all over the country and all over the world. It's a lot of shots, but overall it's tolerated pretty well,
I do.
We see arthritis, we see rotator cuff tears, we see low back pain, we see radicular pain or sciatica, we see a lot of neck patients, people who have had whiplash injuries. We have a digital motion x-ray which can actually show the instability in the neck. It's like a x-ray movie in not so many words.
So basically a patient will get on this apparatus, this x-ray machine, and they'll move while you're taking a film of it. And so that enables you to see
if there's too much motion going on in the neck, which would tell us that the ligaments are too lax. So the patient actually stands instead of laying down like a normal x-ray. And with this, they do a series of movements, bending, flexing and extending, bending their head forward and backward, and side to side, so that way we can see the bones, the vertebrae, and see if there's when the person moves their head forward, if the bones are moving too much, or if, when they go back, if the bones are sliding too much, and then we would treat the area.
Okay, so that's a clear diagnosis as to, or a clear picture as to what you need to do.
Yeah, very objective.
Got you. What types of patients would be an ideal candidate for the digital motion x-ray?
So anyone who's had a whiplash injury or chronic neck pain, even symptoms that you might not even know are related to the neck, such as GI issues or issues with heart rate, or problems with the hearing, or constant mouth pain. A lot of people don't realize that can be related to the neck. Okay. It can be related to cervical instability.
Okay, so all your nerves go through there. So
very
it's
close.
all tied together.
Right.
So it would make sense that various parts of the body would be affected. Tell me, is it strictly for people with, do you strictly examine the neck, or is it all parts of the bodies, or is it just neck specific?
For the digital motion x-ray, we can also do, we can't do the lumbar or thoracic spine or the hip. So we can do knee, foot, wrist, shoulder. So extremities.
Okay, got you. And my understanding is that anybody with pain that you can treat pretty much anything. You can help people heal. And basically what you do, this treatment perpetuates a person's own healing system, and that you can treat anything with the exception of the eyes and the ears.
Just about.
Just about, yes. Okay. Explain the types of prolotherapy that use a patient's own blood or stem cells.
So in addition to just the regular dextrose prolotherapy solution, we can also use PRP, which is where we take your blood and we spin it down and then inject it back in, or stem cells, which we would get from the tibia, iliac crest, or from fat.
Oh, okay. And you centrifuge that, right? Is that how it's done?
For the tibia or iliac crest, no, but okay. With the fat, we do some processing with that.
Okay. So you're using a person's own DNA to help them to create a healing environment within themselves.
Correct.
Okay.
Yes.
All right. Can prolotherapy be used for patients who want to avoid surgery? And what types of surgery do you most commonly help patients avoid?
Prolotherapy can definitely help patients to avoid surgery. We have a lot of patients that come in and they say, I've been told my only option is a knee replacement, or my only option is a lumbar fusion. And we're able to get those patients, as long as they meet the criteria for prolotherapy, we're able to get those patients back to doing all their activities without pain.
Okay, fantastic. I know that you're on Facebook, you're on Instagram, Twitter, LinkedIn.
Yes.
All of those resources. That's how people can find you. We'll also have the phone number posted.
Mm-hmm.
Do you know the process for a patient when they decide that they want to contact you?
So we also have a great website.
Okay.
So if they wanted to check out the website and then they call in, they'll get someone on the phone, discuss their problem a little bit, and kind of do like a mini interview before they even schedule the appointment to make sure that it's an area that we would treat. And then after that, they would do a full history over the phone, so that we can kind of get all the information before they come in, make it a kind of a smoother visit.
Right.
And then, of course, the visit.
Yeah, I understand basically from speaking to the receptionist out front that in addition to being able to call in through the website, there's also a chat service.
There is
now.
a chat.
Yeah,
that is
that's
somewhat
exciting.
new, but yes.
Yeah, that's exciting. Well, I can also tell you from my experience that it was really a wonderful experience that you also incorporate aromatherapy.
Yes.
So all kinds of really kind of ways to help a person relax if they're feeling a little nervous or out of sorts. So I'd like to share that as my experience as well.
We also have ultrasound, and we use ultrasound to guide injections or ultrasound to diagnose as well.
Right. So yeah, and I experienced that as well. So thank you for that. So tell me, what types of conditions does Caring Medical specialize in?
So any chronic pain that the patient is having, I would say we see a lot of knees, a lot of shoulders, a lot of cervical spine issues, but also, a lot of people coming in with ankle or wrist injuries, even ribs, people who are complaining of rib pain, we treat those too.
Fantastic. Okay. Well, thank you for your time. Just one more thing. So have you lived in Fort Myers for a long time?
No, I actually moved from Pennsylvania. I've been a physician assistant for 10 years.
Okay.
And I actually worked in traditional pain management for most of the time. So it's kind of a new, it's new to me, but it's been great because I saw that side and now I'm seeing the other side, which is, I saw a lot of patients who did not improve with traditional medicine. And now I'm seeing them get better.
So how wonderful is that to people responding to something that's non-surgical? I think that's just amazing.
Yeah,
what a great option. Tell me what you love about Fort Myers.
That it's by the beach.
We have the
it's
best
hot
beaches.
and sunny.
Yes. Well, thank you, Katie. Thank you for your time. I appreciate
Thank you.
it. Okay.